Hello, my name is Ryan Hitzler. I'm one of the owners of Flying Horse Medical Center, and my duty here is to make sure that the business runs smoothly. So part of my duties is to talk to all the families when they come in and they want to learn about concierge medicine or they want to learn about what Flying Horse Medical Center is. So I get two common themes in the questions that I get from the patients and the families that come in. The first question is, how are we going to stay in business? There's no way that we can stay in business with the small fees that we charge in comparison to what the families are charging right now in their healthcare premiums. The second question we're always getting is, why would a family want to spend concierge fees on top of their high insurance premiums they're already paying? So let's talk from the business perspective. From our end, we're going to limit our patients to about 500 patients per physician. By having a constant fee, I understand what our income is going to be, as opposed to a normal business model in healthcare is going to be very fluctuating up and down and seasonal. For us, we understand what our income is going to be, so we can keep our staffing appropriate. Also, I don't have to keep a whole bunch of extra staff around to fight insurance companies, to fill out needless paperwork, to go after the payments. I don't have to worry about that anymore, saving us hundreds of hours a week there alone. Now I can have actually our healthcare providers, our physicians and our nurses concentrate on you, the patient, versus concentrating on insurance, which is needless. It is very important to remember that family medicine is affordable. It really is. There's no reason for it to be expensive. Also, we own the land and we own the building. We're here for the long term. That keeps our mortgage rates low, much below market value, keeping our overhead low. Now on the patient's end, why would a patient want to spend money on top of their high premiums to be a concierge patient? That's a very good question. Well, I always have to remind people, just because you bought your insurance doesn't mean you can fully leverage your insurance. You have to spend $1,000 to $3,000 a year per family member in the typical case for your insurance to even fully kick in. Our prices for a typical person is $828 a year. And that includes all your visits. You never have to worry about, should I go to the doctor or not? I can't afford it. What's my copay going to be? We want you to call. We want you to come in. We want you to be taken care of. ABC Nightly News actually just did a recent news story, and they showed how a family in New York, typical family of four, is seeing a concierge doctor. And by the way, this concierge fee is 5 times our fee. And this family is saving thousands of dollars a year. Well, how are they doing that? They're covering only catastrophic insurance. They're taking that savings, they're applying it towards a concierge doctor. And if you take into the potential income you lose by being ill or in a waiting room, long waits, not having access to your doctor, you actually save or potentially save quite a bit of money, and you get superior preventive and urgent care. So the bottom line is, a middle-class family can save money and get superior health care if you use concierge medicine. Common theme I get from patients that they come in, they say, you guys are very untraditional. I always remind them, no, we are traditional. This is the way medicine used to be. What is non-traditional is the way our government's going right now with socialized medicine. That's the big difference. Healthcare is affordable.